Okay.
So we can waziri and waziri. Thank you very much. So the CSS exchange today.
Management, you don't deal with a problem. So they have leaders. So you can tell the leaders, the minister wants to see the leadership. They can select 10 people. Yeah, and stop them so that I can give them assurance, and then I can tell them when we start the dialogue. It concerns other stakeholders, it concerns counties. But it's good to give them that assurance that we have listened to them, you have come to our door. It's very bad, you know, if they say yeah, the whole day and then they go back. We look very bad. So maybe some, I hope I'm not signing this thing. You know, if they don't sign something, they are not yet. What do you do? I just sign. Oh, they are not for you. I was taught by a friend that when I'm not joking, I will even if the ball is going to sign. He said, just joking. So I am very happy to work with you and the rest of the team. Please, the rest I'll tell you tomorrow. There's a way I work. So that I'll tell you outside these cameras, and we'll have a meeting tomorrow. You agree that? Yes. Tomorrow 9 o'clock. Yeah, same team. And then maybe in the afternoon we meet the CEOs of the service. So that everybody can look at nothing to zoo and the rest were politicians. Everybody was a politician. Pablo was a politician. Anyang was a politician. After don't name them. So I really want to thank you most sincerely, Waziri. I want to thank you most sincerely, PS and I, and your next. We are going to mind, so there are many challenges. I had a meeting with your minister. Because the 2 minutes is work. There's something called artisanal mind. Very important. So, and share will work. And this noise can only be stopped through dialogue of give and take. I saw the chairman. You have a CEO who resigned from one of the big corporations. You have doctors like Dr. Nika, now you have lived here and now is the chairman of the committee. So I am ready to work with you. The most complex sample of the Kenyan society. So if I handle those for 8 years, I think I can handle the ministry. There are people who sending text messages. I told you I went to our better. So Waziri, I wish you you must remove the type of mafia. You good people. I mean, doctors have the most respectable profession. Doctors and teachers everywhere in the world. You should not. I'm not saying the men are not competent. There are some very competent men also. But there are two ladies in that ministry. One of them PhD holders, one is a director. But even the CEO of the careful in charge of finance. And they were not foreigners, they were Kenyans from different parts of our country. And when I went to environment, climate change, I also found very, very competent. I hope I'll find very competent ladies here. In environment, I have the most competent people in environment you're going to find are ladies. So when I went to defense, I found the brigadier in charge of chatting, brigadier in charge of logistics, brigadier in charge of operation, very good notes. They are very, very good Kenyans working. I am the only cabinet secretary who was from Professor Lungu to John Bandy to D.S. Dito and technical people like people for Dr. Sikhi. So if all of us work together, we must provide the best solution. And I know 5 presidents in Africa who met in AU, last AU. Ask the president, how did you fix it? How did you get Kenya out of the debt stress? Our neighbors. There is no difference between this ministry, I can equate this ministry to the national treasury. I can equate this ministry to the national security organs of the country. The men and women in the national treasury in the last 2.5 years have turned the business. And the problem in our country is people mix national interest and personal interest. So please, today is fast. It's not up to the truth. No, I might say that what the minister was saying. It's not mine is the truth. If you are sitting here and you want to work for personal interest, then you have a problem. You have a problem. Over 20 years. I have the real opportunity of sitting to work as a member of the online. And it is very important. We must at all times do the work within the confines of the law. This is what I want to tell you. I wish I knew. Some of them will go through private members. Private members bill, some of them will go through. But because you know the law is big, I can allow them. But I think we are sitting on this table, all of us here. Because I have a history. Last night, the last 5 days, I was reading. This teamwork is very, very important. And I'm sure if we talk to my colleagues in defense, we're here today when we go to climate and environment and forest. People must have secure, accessible, affordable working effort. Security, I went to climate security. Where should I go? Climate now is a serious security and global project. And His Excellency, I was just telling her that this morning that when I was a Minister for Defense, it was one of my most difficult moments. Because every morning we have to have a belief to see is the country safe. Looking for an invisible enemy called war. In fact, for a country to move from developing nation to a developed nation, if health and education are working, then that country can be termed as a developed country. Very, very key. And because the prosperity of any nation, I have seen it and repeat, depends on the health of its citizens. Which has really many times spoken for you to the bottom of our heart. But she's one of the few ministers in this administration.
Good morning, sir. My name is Benjamin Murkomo. I'm looking at Docket Sciences. National Malaria Control Program.
Morning, sir, and welcome. Dr. Lenai Joseph, this is the Director for Primary Health Care.
Ladies and gentlemen, good morning. Good morning. Today is a great day for us. We are having the handover for
Good morning, good people.
document, which is the out documents you have to know.
in slaying them. And then to Madam Barassa, maybe as you're leaving, what is the most important experience that you're taking with you from this place?
Taxpayers' money was lost in the process. Thank you.
Number one,
Time when the health ministry is really in the eye of a storm. We have various strike threats on the table. We have ongoing strikes by UHC workers. The country is facing an...
yes.
My name is Sheila Chelangat from TV47, and some of the doctors, even those that are outside, are skeptical of you being at the helm of this docket. Argue
how can we wait for PSS? How can we wait for my PSS?
I thought you were coming down.
And I want the people of this country to listen to me. When an audit was done on the system of NHIF, a forensic audit was done, 3 million fake people who are accessing NHIF resources were found out. And I'm sure those people and those fake patients, they are watching me now. We know their names. Those facilities and providers, they are watching me. We have their names. Those who use a biometric fingerprints that don't belong to the original person. And if I am pushed to the wall, there are institutions in this country, not the Ministry of Health, that deals with the fraud, independent institutions. We will push their names and we will push their facilities, entities and locations. We must tell the Kenyan people the truth. So 3 million people were found who used the NHIF resources irregularly, illegally, and it became a huge health care fraud, health insurance fraud. And ask yourself a very good question. Why is the mortality rate, women who are dying when giving birth, why is the mortality rate very high in this country? Our neighboring countries are doing better. Because some of the drugs given to those mothers to stop bleeding are not the right drugs. Ask yourself. So there was a lot of fraud in the system. So this digital health system, integrated system, is going to deal with all that. And that's why there is a lot of opposition to the reforms that is taking place in the health sector in our country. And I want to assure the people of Kenya, from the president, universal health care will work. It will work, inshallah, and it will work for the people of Kenya. And it will not work for the elite. It will work for the ordinary citizens. Those of us who are standing on this side, we have a very robust insurance scheme. The elite, for many years, have enjoyed good, robust insurance scheme. Universal health care will give a better health care, access, affordable, quality to the many and millions of Kenyans who cannot afford it.
There has been 163% increase in social health insurance membership, with the current registration standing at 21 million, up from 8 million that had registered with the defunct NHIF. The total collection of the Social Health Authority is currently upwards of 31.6 billion, we have so far settled SHA claims to the tune of 24 billion and a further 21 billion under the Primary Healthcare Fund. This has ensured expanded access to social health insurance with 13 million additional Kenyans covered. Meanwhile, the gazettement of new SHA packages beneficiary will be entitled to enhanced benefit packages that will cater better for cancer treatment and radically improve ICU payment limits. Ladies and gentlemen, during my tenure, the ministry tabled key cabinet memos, one of them focused in upgrading the Jaramogi Oginga Odinga Hospital in Kisumu County to a level 6 healthcare facility. While taking care of long-term progress in our healthcare agenda has been a key preoccupation, we have been vigilant in ensuring that disease outbreaks that could compromise our efforts to keep Kenyans safe are in close check. Such outbreaks are Mpox, cholera, Marburg, Ebola from neighboring countries that have had our medical experts on high alert 24/7. Regarding continued funding of our programs in the wake of withdrawal of USAID support, we have considered alternative ways of keeping our healthcare system well-oiled to continue serving our people. The future can only get better.
SHA will settle hospital claims by the 14th of each month. NHIF used to do 6 months and more. So by the 14th of every month, SHA will settle all the hospital claims by the 14th of each month. I recently got a new name when I talked about SHA, when I was a Minister for Environment. Some people called me bulldozer because of a video making rounds. That was my genuine show of support for Taifa Care, even before the President, William Ruto, deployed me to the Ministry of Health. At that time, I was simply doing what I believe every government leader should do, championing what will make our health system work under the whole government and whole society approach. I will not run away from that name. Please keep on calling me the bulldozer. In fact, let me own it from today. Bulldozers don't build. They clear the way. They remove the obstacles. They make space for progress. And that's exactly what I intend to do here at Afi House. Was Susan Nakumicha a doctor? In the last 20 years, only 2 doctors served at the top leadership of this ministry. Professor Anyang' Nyong'o was the Minister for Medical Service. Beth Mugo was the Minister for Service. My good friend Kagwe was the minister. They were all politicians. So those who are there, they have other agenda. And I have a business to do here. And I don't do it alone. I do with the help of the men and women who work here. I do with the cabinet. I do with the president's advice, because my business is to advise the president. I work with the parliament, which was my home for 16 years. So tell them that the Minister for Infrastructure is not an engineer, he's not a roads engineer. My sister is a medical doctor. She is not a climate and environmental trained person. So those are very pedestrian arguments. As earlier pronounced by His Excellency the President, effectively to today, 1st April, the ICU and the HDU bed rebate has been enhanced to Kenya shillings 28,000 per day, while oncology package for cancer patients has been enhanced to Kenya shillings 550,000 per person.